Yeah, perfect. So my name is Daniela Broley. I am a consultant in NHS Grampian in sexual health and HIV, and I also co-chair a group of clinicians which come together across Scotland to discuss best practice. And obviously, we've been having quite a lot of emails recently with monkeypox, trying to manage cases coming through, and also the vaccination programme. And I also answer to the sexual health wifey, which I'm known as up in the northeast of Scotland. And my pronouns, sorry, are she and her. So, sorry, I'll just try and put this on. So, what is the vaccine for monkeypox? Well, I think in a way it's useful that we've had a pandemic, or sorry, another outbreak of infection where we actually have a vaccine which is hopefully almost readily available, unlike COVID, where we had to wait for quite a while. So there is the smallpox vaccine, which is available, which we think has quite good cross cover for monkeypox. There's still being obviously further trials being done because of the increase in the number of cases. A lot of the trials done previously were very small numbers of individuals. So we're hoping that obviously works well. The good thing about it is it's a third generation vaccine, so there's less side effects than the previous smallpox vaccinations. However, they were still used very widely in the population. It's slightly confusing in that it is called, if you look up the sort of information about the vaccines, it does say it's a live vaccine, but it's actually replication deficient. So it means that the virus in the vaccine has been changed so many times that actually it doesn't have the genetic tools to be able to make new copies of itself. So it's very safe for pretty much everybody to take, and it still mounts, we hope, a good immune response to the virus. And there's two different types, and basically they're basically the same. It's just different companies that make them, and their names are there: Invinex and Jynneos, and they are interchangeable. So we do recommend that people get 2 doses, and it might be you get one Invinex first and a Jynneos next, and that's okay. It's a bit like COVID, getting different brands of vaccine is okay. The only time we would recommend that people have 1 dose of the vaccine is if they've had smallpox vaccine already and they're not immunocompromised. So if you are lucky enough to be born before 1971, you may well have had that vaccine, and that will be asked for anybody who presents for vaccination. We take a vaccine history from everybody. So how well does it work? It works, pretty well against smallpox. There, as I said before, there are ongoing trials, but so far so good. It's looking like it's a pretty effective vaccine, but we will need to wait the outcome of formal and larger trials to be sure exactly at what level that effectiveness is at. As I said before, it's 2 doses. However, we will come on to the fact that just now we are focusing primarily on first doses, and that is obviously because of vaccine supply and trying to get as much coverage as possible, exactly the same as what was done for the COVID pandemic. There are limited evidence about how useful it is for post exposure. However, it is given, as Colin said, it's better, like anything that's given in a post exposure situation, it's better to be given as soon as possible, but can be given up to 2 weeks. And again, that's something that it is important to potentially take away from here. One of the things about preventing onward spread is potentially sharing contact details more with partners, if you feel comfortable doing that, in order to make you obviously more make it easier for people to get in contact with contacts if they are eligible for post-exposure vaccination. One of the things that people often ask about vaccinations, and again has been much more in the media recently over the last few years, is about vaccine safety. So as I said before, it is a safe vaccine. The traditional smallpox vaccines were used widely in the population, and this is an even safer vaccine as a third generation. It's non-replicating, so it's not technically a live vaccine. It's similar to other vaccines in that sometimes you can feel a little bit rubbish afterwards. So you might have a bit of a sore arm, a bit of redness or swelling, and also flu-like symptoms. So that could be anything from headache to fever, feeling tired for a few days afterwards. And again, different individuals will respond differently to vaccines. We do have a caution about individuals who have atopic dermatitis. It doesn't mean that you can't have the vaccine, but just a caution that you may be more likely to have a reaction to the vaccine, or that your dermatitis might get a bit worse, particularly if it's severe. However, I would say that if you have that condition, please still present for vaccination if you're in an eligible group, and we can have an informed discussion with you, with the clinician who is vaccinating you. There are some cross-reactivity with other allergies, and we have to be cautious, particularly if somebody has had a previous severe reaction or an anaphylaxis with several different types of antibiotics, and also chicken or eggs. But it would have to be a pretty severe allergy anaphylaxis for us to not give it. So again, if you fall into that category, please still present for vaccination, and that can be discussed on an individual case-by-case basis. And again, pregnancy and breastfeeding, it's a balance of risk. But again, if somebody's at risk, we would say it's better for them to have the vaccine. So who is eligible? Well, this has very much been based on epidemiology and may change in the future, but currently what we are advising is gay, bisexual and other men who have sex with men, so GBMSM, including transgender men obviously, and transgender women who are either prescribed PrEP or have been prescribed PrEP, or who are PrEP eligible and perhaps have declined, or are living with HIV and therefore don't need PrEP. And that includes things like having multiple partners, with unprotected sex, and also a recent bacterial STI. The other risk factors include attending sex on premises venues, planning to travel with sexual contact with new partners at that destination, or there can be other groups or risk behaviours at clinician discretion. And as Colin said before, contacts, depending on what type of contact that was and the history, can get post-exposure vaccination, and healthcare workers, but that's quite a strict criteria. Healthcare workers who are either involved in directly testing cases or in treating individuals who have tested positive. So accessing the vaccine, the vaccination programme in Scotland is being delivered through sexual health services in the vast majority of areas, apart from post-exposure, which may be done through other settings. And sexual health services are actively contacting individuals who they know are eligible. However, I would say if you're new to the area, if you've moved from a different health board or from another area in the UK or abroad to Scotland, and you feel you're at risk, and you're not known to services, or you've potentially just not used services in the past, then please do present so that services can add you to their eligibility list and try and get you an appointment. NHS Inform has a list of all sexual health services in Scotland, and also third sector colleagues can signpost you or help you access services, or can help negotiate that if you feel that accessing services as it hasn't been a good experience, or that you feel there's barriers to you accessing services. So the Scottish programme so far, there's been quite a lot of media coverage of this over the last few days, so you may well have seen it, but the Scottish programme is up and running and has been for the last few weeks. We've currently been allocated 3,000 doses for an estimate of over 6,500 individuals. That is a very crude estimate. It could be higher or lower than that, depending on the additional amount of individuals who don't access services, and obviously also vaccine uptake. Approximately 800 doses have been given so far. It's probably slightly more than that because there can be a lag time between getting that data collected across services. And the thing really to emphasise currently is that there is a limited supply of vaccination, because there is obviously a real peak in global demand, and areas with the majority of cases are being prioritised, and that's not just within Scotland or the UK, that's also internationally. So although we may require 7,000 vaccines currently, we only have 3,000. However, services are planning to give all of the allocated doses by the end of August, and there is further doses expected to be delivered to Scotland in September. So hopefully there shouldn't be too long a wait in terms of get between now and getting all of our cohorts vaccinated with the first dose. However, there may well be a wait for several weeks for individuals to be able to access the first dose of the vaccine. So there are different things that people can do to keep themselves safe. And I think Alan and David are obviously going to discuss this in a bit more detail, but there's just some pointers here that potentially we can go into in a bit more detail, either as I say, in Alan and David's chat, or with questions at the end of the presentation.